From Fox 5 News, this is Good Day New York.
Are you finished playing with the props?
Well, we're going to have it in a second. Look at that. Check that out. This is a real mouth from a real person.
It is not.
That's what the doctor just told me.
He's teasing you.
Let's set up... You were?
Absolutely not.
It's a real person.
All right.
Let's set this up.
All right. In New York City, we all deal with a lot of people on a day-to-day basis, which means a lot of close contact, and bad breath could be a total turnoff.
She said bad breath. How can we avoid the embarrassment of bad breath, also known as, I believe, halitosis? Joining us this morning is Dr. Greg Diamond, who is a periodontist and founder of the Diamond Schlesinger Group. Welcome to the show, sir.
Good morning.
You treating a lot of this? People come in and say, I have chronic bad breath, and you have a solution?
You know, most people that come into the office have no idea that they have bad breath.
But you break it to them.
Do you say anything?
Well, you know, I'll wear my mask. People come in. I mean, it's quite obvious, as you know, when somebody comes in with halitosis, it smells. So we kind of break it, but they're more concerned about other facets of bleeding, loose teeth, other problems they may exhibit that lead to halitosis.
All right, give us an idea. What causes it and what can we do to avoid it?
Well, there's various factors. Number one is poor oral hygiene. Most people do not know how to take care of their teeth. So we have various instruments we'll review with patients in terms of how to clean their teeth. Secondly, it may be the most common area of the mouth that accumulates bacteria is the tongue. So when bacteria forms on the back of the tongue has a lot of nooks and crannies. And when the bacteria accumulates on the tongue, it gives that rotten egg smell. And that's really the smell that 80 to 90% of our patients exhibit. Although, they don't realize it, but they come in and you can smell it. And then there's other factors. There's broken restorations in their mouth, fillings that don't fit, accumulate bacteria, and then there's dry mouth.
My sense is that something that would really help is if we brush after every meal, like we were told growing up. But that's kind of impractical. You can't brush after every meal, at least in the city. Right?
No, it's impossible. Nobody carries a toothbrush in their back pocket. But we can rinse after meals. Just going into a bathroom after a meal, washing your mouth out with water will be, it's significantly reduced the potential for that bacteria to grow on the teeth.
All right, let's go through some of this stuff. You say flossing. You have to floss, what, is it once a day? Or
I always recommend flossing twice a day, in the morning when you wake up and at night before you go to sleep.
And you agree that we should be chewing sugarless gum?
100%.
Really?
Yes.
You're one of the 4 out of 5 dentists who recommend.
Well, I personally like sugar gum, but yes.
What, you bubble yum? What do you chew?
I love gumballs.
That's funny. That's bad for you. Doc, regular toothbrush or electric toothbrush?
Well, my regimen for most patients, although everybody differs, dental flossing first. They may use a proxy brush. There's different instruments that we use that we can substitute for not using floss. But I always recommend an electric toothbrush. And
you
always
brought one.
Yeah.
Okay,
let me show you how this works.
Why is that better than a manual toothbrush?
Because a manual toothbrush, we really have no control. When we brush with an electric toothbrush, when this evolved, we understood that putting the bristles of the toothbrush both on the gum and the tooth allows us to get underneath the gum line. Those bugs that create that bad breath exist under the gum line.
Bugs?
Bugs. They're bacteria. Okay. They are living bugs, and they form what we call plaque.
A little bit. Bacteria I can deal with. Bugs,
they are bugs. You look under a microscope, they do move.
Yeah.
And they do accumulate on the teeth, and they form plaque, and they emit these terrible odors. So this instrument is great for removing that.
Okay, one last thing. Lasers. Are you doing something with lasers, and how bad does it have to be to get this laser treatment?
Well, what we're finding is patients in our practice who come in with periodontal disease, and what that really is inflammation of the gum tissue in conjunction with bone loss. So they develop these little separations of the gum, and I have a little photograph here so you develop separations of the gum away from the tooth. And the bacteria accumulates down underneath the gum line.
Right.
And we can't get in there without toothbrushes. So now we have an instrument called the erbium laser. The laser is phenomenal. It will actually, with this little tiny light, we can put it down underneath the gum tissue, vaporize the bacteria, and eliminate it.
That's great. Doctor, we never got to this friendly guy. Are you telling me this person, these are real human teeth?
Ouch.
Well, you know,
those are not real teeth.
They look
They're
real.
They're plastic teeth.
They need Crest white strips
Not
on the
really.
yellow side. No. Tell us about this. What's up?
Well, that's just a dentition. That's just the basic.
For you to play with.
Oh, it's just a decoration. Sorry.
I brought it for you.
Dr. Greg Diamond, thank you so much for coming in and sharing
You're very
your
welcome.
information with us. Okay, that's good. We learned something this morning.
Yeah, brush.
Yeah. No, but
we're going to use the definitely the
electric
one.
one. Okay.
Upgrade.
Absolutely.
All right, for more information on the causes and the treatments for bad breath, log on to our website.
And we may have it if we don't even realize it.
Yeah.
We're going to put all this stuff on our website, myfoxny.com. Click on the Good Day tab. We'll be right back.